4:15, and it's a note by Karen Kimball, RN.
Did Nurse Kimball actually make a check on him personally at that time?
I don't know. But the note says, patient remained stable throughout the night without complaint.
Doctor, I know that. I know these records. My question now, can we go back to 116?
Yes, but that was what I recalled, and I wanted to make sure, so I wanted to see what was in the record on that. 116.
Well, first of all, we don't know if she actually made a check at 4:15 at all, do we?
Well, I'm just trying to give you an accurate picture of what's going on. Do you have an objection to that?
Well, I know what the accurate picture is, so all I want you to do is just answer the questions I ask you.
Okay.
Okay, now we're on page 116.
And we object to the prefatory part.
And it indicates that there are no checks, documented checks, from 24 a.m., 2400 hours a.m. until 6:45 in the morning. True? No checks documented.
I guess that's true.
Had there been documented checks, they should be on this chart, correct?
Correct.
And then you look over on Sunday, and there are no documented checks of Matt at all on Sunday, correct?
Correct.
Now, does that violate the rules of the medals itself by not documenting checks on those nights?
Form, foundation.
I don't know if the person, if he was checked on, but yeah, yes, it's not documented there.
Well, if they checked on them, it should be documented, correct?
Should be.
Would you be critical of the person for not documenting the record when they should have?
I would like to see it documented.
And when you read the eye-to-eye observation level on document 640, Bates 640, and it says this level is for patients with some suicidal ideation. If Matt had suicidal ideation on Saturday or Sunday, he should be on eye-to-eye. Would you agree with that?
Form and foundation.
No.
Per this regulation.
No, I wouldn't.
Tell me why, if I misread this regulation?
Some is very ambiguous.
Well, have you
Excuse
ever?
me, he hasn't finished his, I don't think he's finished his answer yet. You asked him to explain why.
Okay, I'll withdraw that question then.
Okay.
The question's withdrawn.
In
Doctor, I've withdrawn.
Oh,
the
He's
okay.
question.
withdrawn it, so.
Fine.
Okay. When you say this document is ambiguous, did you ever bring that to the attention of anyone at the medals, that you have an ambiguous policy and procedure
Object as to form.
prior to Matt's death?
Pardon me, object as to form.
As I've said earlier, if we have 70 patients, we might have 20 patients that have some suicidal ideation. It would be a judgment call by the psychiatrist and nursing, but mostly by the psychiatrist, to determine who needed to go on eye-to-eye and who didn't. At any one time, we usually choose the really highly suicidal patients to be on eye-to-eye. And I didn't consider Matt to be highly suicidal until late Saturday night.
Okay. Late Saturday night, you didn't receive a call from anyone at the medals saying he's highly suicidal, did
No,
you?
and I'm saying that in retrospect, having reviewed the chart afterward. I didn't get a call.
Tell me whether you agree with this comment or not. Departures from policies and procedures by the psychiatrist deserves a documented explanation.
You know, I don't know what to say.
My question is this, it's just it's a straightforward question. Do you agree with this comment. Departures from policies and procedures by the psychiatrist deserves a documented explanation.
I think that there's a concept in legal medicine called usual and customary. And our usual and customary practice was to put people who were highly suicidal on eye to eye. In my opinion, Matt wasn't highly suicidal for most of his stay. He became highly suicidal as I read the whole picture on Saturday night.
Judge is not responsive.
So I don't think it applies that this eye-to-eye policy applies. Before he became highly suicidal, would I have liked to have had a call Saturday night?